Out of all the coronavirus cases in the world, 1 out of every 5 is in the United States. Despite hard lessons in the spring and restrictions over the summer, infections are still rising. New York City schools are closing today, and students will be learning from home.
We have to do more to fight back this second wave. So the state has made very clear additional restrictions are coming. We're putting more stringent measures in place so we can get schools back up and running soon, that we can protect New Yorkers across the board.
So why is the US, an economic powerhouse, struggling more than any other country in the world? Total cases in the US have passed 11 million. Over 250,000 have died, and a growing number of Americans are uninsured. Is it the fault of outgoing President Donald Trump? And can incoming President Joe Biden clean up the mess? Our correspondent Carolina Chimoy reports.
El Paso is on the border with Mexico, but no one is talking about the wall anymore. The pandemic is raging here. Numbers are soaring.
Right now we have about 241 inpatient COVID-19 cases. Now to contrast that with about 45 days ago, we only had 30. But a lot of those people that you see going into these tents behind me, they will wind up inside our hospital.
Health authorities are already arranging to move patients to other cities if the hospitals become overwhelmed, planning for months of strain. There is already a backlog in dealing with the dead. Refrigerated morgues outside the hospitals serve as makeshift mortuaries. Funeral homes in El Paso are so overwhelmed that families sometimes have to wait a week to bury a loved one. Funeral directors themselves are struggling to cope.
El nivel de estrés es muy elevado.
The level of stress is very high because it is not comparable to how it used to be. Some months ago, we had around 30 services per month. Right now, we're having around 80.
This second wave of the pandemic is not only hitting record numbers of people, many of whom could die. Local lockdowns in El Paso to try and curb the spread are wreaking havoc on businesses.
This is where the economic effects of the pandemic can most clearly be seen. Downtown El Paso seems abandoned. Also, this restaurant wasn't able to keep most of its staff. Now the owner has to attend the few clients himself. The current situation had a clear impact on his political decision. He voted for Joe Biden. I knew he could do better than Donald Trump, and I think we all hope the same. We hope for a different government that supports us. Uriel Samaniego works just around the corner. For him, the presidential race is not over yet. Biden is not going to be the president. It's going to be Donald Trump. He feared his business might be hit by the pandemic, but now he has orders until July next year. Republicans, he says, are good for the construction sector. Despite his support for Trump, he has his own opinion on COVID-19, especially after he tested positive. Everyone is going to get the virus, and we're going to fill up the hospitals. Testing is one of the crucial instruments to avoid this problem. Miguel coordinates 10 testing centers in El Paso. He works for a private company that is being paid by the state of Texas. But his main concern in the pandemic is not political. I don't have fully knowledge of what Joe Biden is planning to do in his administration, but until now we haven't had any kind of difficulties with the current administration. I don't think it's a matter of resources. The main concern is how to communicate to the people what to do or not. Trump supporters, Biden supporters, two different sides that seem to come together in El Paso.
Johannes Timm joins us from the German Institute for International and Security Affairs. He's in Tallinn. So, in your opinion, what went wrong in the world's top economy?
Well, there are two sets of factors, I would say, that went wrong. The first set has to do with the Trump administration. Trump himself wasn't very interested in listening to experts, doing the right thing, trying to do the best job he can in mitigating the spread of the virus. The other set of factors concerns structural issues in the United States, the fact that they have a very unequal healthcare system, the fact that the welfare state is quite weak and quite fragmented, and a lot of people don't receive welfare. And the third factor is that they have federalism, and a lot of action is actually up to the states and their governors and not to the central government. I would say those are the main reasons why it didn't go so well in the United States.
Let's pick up on the first one of those then. What effect did the outgoing president play on the course of the virus, his playing down of the virus?
Well, I think we all are familiar with the press conferences that he gave in the late spring and early summer, where he really just rambled and gave all kinds of conflicting messages about what to do to fight the virus. And we also know that he gave an interview to Bob Woodward where he warned of the virus already in early March. But then he played it down to the public because he didn't want to hurt the economy, and he wanted the stock market to do well. And I think the conflicting message, the fact that he didn't listen to experts, the fact that the people he appointed, apart from the medical experts, but the people he appointed on a political level were not the most competent ones, they all contributed to the bad response that didn't really help in containing the virus.
So how will the new president do things differently? I guess he's got a bit of a mess to clean up.
Right. I mean, Joe Biden already emphasized that this is one of his main priorities. He's already appointed a council of advisors to fight the pandemic. At this point, he's kind of in a bind because at the moment, the virus is really spreading rapidly and is kind of out of control. So I wouldn't expect him to fix the problem soon after he enters office on the 20th of January. I think it will be quite hard at this point to contain the virus. The people are tired of restrictions, of lockdowns. And I'm afraid that I think the solution will only come when a vaccine is approved and widely distributed.
One positive, in your study, you wrote these huge aid packages helped stop poverty from growing in the US. But that aid's temporary. What now, and what's that mean for Americans' health?
Right. The four aid packages that were passed by Congress had a volume of over $2 trillion, and they actually did quite a lot to mitigate the economic damage of the pandemic. They provided a stimulus to the economy, and they also helped simple people to make ends meet. Included in that was a $1,200 check for every adult citizen below a certain income group. Plus, they actually extended unemployment aid and lifted unemployment aid to $600 per week, which at first actually lowered the poverty rate. Despite the bad economy, poverty actually went down. But those measures expired at the end of July, and Congress has not been able to agree on an extension. So I think that's also one thing that Biden is going to try to do, is get Congress to pass another aid package.
Even if you are well off, you're not going to be spared from the coronavirus, are you? I mean, if everyone else around you is in a worse situation or affected by the virus.
Right. I mean, the virus doesn't discriminate, right? The virus itself can hit anyone. And as we saw from the fact that even President Trump contracted it, nobody is really safe. On the other hand, the effects of the virus have been very unequal. First of all, the U.S. Healthcare system is unequal to begin with. The quality of care varies a lot between regions and even within regions. The New York Times found out that during the first wave of the pandemic in March, the death rate in the poorer areas of New York City was 3 times as high as in the rich hospitals of Manhattan. So the effects have really been unequal. As people of color, Blacks, Latinos are especially hit hard. And even recently I read that their infection rate or their hospitalization rate is 4 times higher than that of white people. So while the virus itself doesn't discriminate, its effects can be very unequal and are very unequal.
Johannes, Tim, thanks for joining us today.
My pleasure.
And time for your questions on the coronavirus. Here's Derek Williams.
What are the differences and similarities between flu and COVID-19?
This is a regular question now that flu season is upon us in the Northern Hemisphere. Let's look at the similarities between the two diseases first, starting with how they spread, which for both is mainly through droplets emitted when infected people cough or sneeze or talk. With both respiratory diseases, people are also contagious before they begin to show symptoms themselves. Both can also have the same general pathology, at least at first, so many of the same symptoms. According to the U.S. Centers for Disease Control, the overlap includes fever, cough, shortness of breath, fatigue, sore throat, runny nose, muscle pain, and headache. So if you develop those symptoms, especially in combination, it's a good idea to get tested. Finally, of course, both can kill you. But that brings me to the first of the big differences I want to mention. COVID-19 is a lot more likely to kill you than the flu, especially if you're elderly. Our best current estimates say between about 6 and 10 times more likely. COVID-19 patients also appear to be contagious for longer than flu patients and more contagious than they would be if they had the flu, which isn't surprising, really, because for most of us, SARS-CoV-2 is still a novel pathogen that our immune systems have never encountered before. Most humans have encountered flu strains before, and although they mutate rapidly, which means they can evade the immune system again and again, experts say to some extent that forewarned is forearmed. Finally, although both diseases can cause serious complications like inflammation of the lungs or the heart or the brain or other organs, COVID-19 seems to do it more often, which to at least some extent explains why it's more deadly.